Okay, so hello everyone. My name is Brandy and I want to thank you for joining us today. Alexa and I are students at UH Manoa who volunteer with the Hawaii SHIP program. We will be presenting caregiver resources with a focus on home health care today. This presentation is the final piece of our service learning project with Hawaii SHIP. It will go over home health care and its relation to caregivers. And as a disclaimer, we will be framing this presentation as though the audience members are caregivers or potential caregivers for kupuna who may need home health services and coverage. Our presentation gives a brief overview and should only be about 15 minutes long. Okay, so before we begin, I will explain what the Hawaii SHIP program is. The Hawaii State Health Insurance Assistance Program is a federally funded, volunteer-based program that is administered by the Department of Health. In addition, it is also a part of the Executive Office on Aging. The purpose of Hawaii SHIP is to provide free Medicare counseling and assistance to the public. Trained volunteer counselors can provide Medicare information, assistance, and referrals. They also host fairs and exhibits open to the public. Before we dive into home health care, I wanted to explain what a caregiver is and what it means to be a caregiver. So in simple terms, a caregiver is a person who tends to the needs or concerns of a person with short or long-term limitations due to illness, injury, or disability. Caregivers typically take care of older adults, also known as kupunas here. To understand the importance of a caregiver, you can think of healthcare as a three-legged stool. Family caregivers serve as one leg of the stool, professional caregivers such as doctors or nurses act as another, and the care recipient is a third leg. So if you think about it, without all three legs, healthcare cannot be as effective as it needs to be. In this slide, we have included statistics to show how common it is to be a caregiver. So as you can see, 53 million Americans are providing unpaid care for relatives and friends. And out of these 53 million people, 41.8 million of them are looking after care recipients who are age 50 or older. And diving in deeper to local data, as you can see on the right, in 2020, caregivers in Hawaii provided 131 million care hours worth 2.1 billion. So the statistics show in the slide indicate that there is a need for caregiver support and that they provide care mainly for kupuna. So there are two portions to this presentation. The first half covers the basics of home health care, and the second half will cover helpful resources for caregivers. And I will now pass it over to Alexa.
Thanks, Brandy. So we can go to the next slide. So what is home health care? Home health care refers to a really wide range of healthcare services. These services are provided in the home to someone, typically because they have an illness or injury. It's more convenient and usually less expensive than hospital or nursing facility care. So on this slide, we have a list of home healthcare services. As you can see, there's a lot of different types of services. So I'll just elaborate on one as an example, and I'll elaborate on physical therapy. So physical therapy is a service that can be provided in the home to someone so that they can improve or maintain their current level of functioning or mobility. And if you want to know more about the rest of the services, because there are quite a few, you can visit the link that we have on the bottom of the slide. So going further, if you're a caregiver and your loved one needs home health care, you will need to look for a home health agency, also known as an HHA. A home health agency is an organization that will provide home health services to your loved one. The employees at home health agencies are known as home health aides. So here in Hawaii, home health agencies must be licensed. If they're not licensed, that means that they're operating illegally. And one way to find a licensed home health agency here in Hawaii is to look at the list of agencies on the Department of Health's website. And that's the link that we have there on the slide. And we can move to the next slide. So currently on the screen, we just put a screenshot of what that site looks like for you all to see. It is the Department of Health's page, and it has all the licensed home care agencies. It's super simple to navigate. If you want to look for a home that's here on Oahu, you would just type Oahu in the search bar, as I did, as you can see in the screenshot. So there's currently 68 licensed home health agencies on Oahu. And if you want some more information on HHAs here or in general, there's plenty of information available on this website. Another way that you can find a home health agency is to use Medicare.gov's Care Compare tool. With this tool, you can see home health agencies that are specifically Medicare certified. And if you don't know, Medicare is health insurance for people that are 65 years old and older. So that's really helpful if you're a caregiver taking care of a kupuna. So with this tool, if you're planning to use Medicare to pay for your kupuna's home healthcare services, you can see the certified agencies on this website. So we'll move to the next screen. So here we can see a screenshot of the Care Compare tool. On the left-hand side is what it'll first look like. It's the search tool. So under location, you can enter the city you live or your zip code. And then under provider type, you'll put in home health services, and then you'll click the search button. And what will be brought up is what is on the right hand of the screen. So I used Pearl City as an example. So what we can see is a few home health agencies that are Medicare certified that serve Pearl City. And you can click on each one, or you can compare different home health agencies with this tool. And just as a disclaimer, if you do decide to use this tool, please follow up directly with the home health agency that you're interested in, just to make sure that they're still offering the services that they have listed.
Okay, we will now transition from the basics of home healthcare to helpful resources for caregivers.
So the type of resources we're going to be discussing today include social, educational, one financial resource, and some transportation resources that all relate to home health care.
The first organization that we wanted to go over as part of the social and educational resources is Project Donna. So Project Donna is a local organization that provides support to kupuna through a variety of programs and services. One service they offer is visitation. So visitation can be volunteers visiting kupuna in person or calling them on the phone to provide them a listening ear. They also offer home services such as light housekeeping, minor home repair services, and decluttering. And in addition to that, there are also like a tremendous amount of caregiver support resources for caregivers, such as counseling, webinars, and training. And you can also find their contact information to the right of the screen right here.
So the second organization that we wanted to just give a brief overview is the Caregiver Foundation. It's also local to here. And this organization also provides support and assistance to caregivers. They have a lot of resources that relate to home health. For example, they have specific webinars. They also have cleaning and organizing services for caregivers and their kupuna, which is really important because we think it can be hard to keep things organized and maybe even sanitized sometimes when you're a caregiver and you're juggling so many different responsibilities. And another really cool program that they offer is the Caregiver Bootcamp. It's open to new or current caregivers. It's a month-long series of sessions, and it's completely free of charge. So if you are interested in any of that, you can see their contact information here on screen as well.
The last organization that we provided is the Palolo Chinese Home. Their commitment to meet the needs of Hawaii's elders extends to the residents in their on-campus nursing home and care home, the participants in their on-campus senior daycare program, and the growing number of clients in their in-home services in communities throughout our island. The services that they offer are the Hawaii Neighborhood Outreach to Age, in-home personal care, meals to go, and home cleaning services similar to the other organizations that Alexa mentioned. And similar to the other organizations, their contact information are also to the right.
So we're now going to transition into the financial resource. So as a caregiver, knowing how you're going to pay for services is important. And Brandy and I just want to be upfront and state that throughout our research, we found that there's really very limited financial resources for caregivers and the kupuna that they're taking care of. Most of the resources that are offered are typically for low-income kupuna that don't have a caregiver. And so most of the available resources also don't cover the cost of home health care. So this is just important to keep in mind so that you recognize you might need to start planning and saving now if you have a family member that you may need to take care of in the future.
Just like Alexa just mentioned, so we will go over the Medicare eligibility and how home health care is covered under Medicare. So there is one financial resource that is widely available and can help cover the cost of home health care, and that financial resource is Medicare. And as you all may have heard of or already know, Medicare is health insurance for those 65 years or older. In order to be eligible for home health care, costs to be covered by Medicare, your kupuna has to already be enrolled in Medicare. They also must be homebound, which according to Medicare.gov means they would be having trouble leaving home without help. They also need the approval of a doctor to receive home health services. So as long as there's approval or referral from a doctor, they will be good to go. And if you have any specific questions about Medicare enrollment or health insurance plans, you can go ahead and contact Hawaii SHIP. And just a reminder, as we mentioned, their services are entirely free of charge.
So if your kupuna is enrolled in Medicare and meets all the requirements that Brandy just went over, the bottom line is that you/your kupuna will pay $0 for services that Medicare covers. And if you want to see the full list of covered services, we have the link at the bottom of the slide for you to see. So unfortunately, Brandy and I are not experts in Medicare, and we cannot answer specific questions about costs, but we can tell you that when you contract a home health agency to provide services for you, they need to provide you with an advanced beneficiary notice, which should outline all your costs for all the services that you will be receiving. And in addition to that, you can talk to your doctor or your healthcare provider to find out specific costs about services that you may or may not want to use.
Moving on to transportation resources. So we know that transportation can be hard to come by for a kupuna, and we know that caregivers or family members are not always around in the day to take your family members somewhere. So we've listed out a couple of organizations that we will be going over in a bit that helps with the transportation resources and expenses.
So the first organization that offers transportation support services is Project Donna, which Brandy went over earlier. They offer transportation for a wide range of things: medical appointments, grocery shopping, religious and legal services, and even more. So if you're interested in that, please follow up using their contact information that we have here on the screen. And the second local organization that offers transportation services to Puna is Catholic Charities. They also provide transportation to and from a wide range of places. For example, medical appointments, grocery shopping. If your kahuna wants to go to a local club or fitness class at the YMCA, that service can be provided to them. So please contact Catholic Charities using the contact information if you're interested.
Okay, so these next couple of slides have other important resources for caregivers, although not specifically related to home health. If you have the time, you can feel free to look at them later on. They are wonderful resources that can help immensely with caregiving. And examples include, the Office of Aging, the Department of Health. We also have more, which one important one is the Medicare Annual Handbook 2022. There is a copy online, or you can actually request one to be sent to you on the Hawaii SHIP website as well. And more caregiver resources, such as the Caregiving for Family and Friends, Hawaii Family Caregiver Coalition, and Kokua Kalihi Valley, which is a community health center. Here are our references for the statistics and data that we've gathered for this presentation.
And here on the screen, we just have the contact information of Hawaii SHIP. And that will be very helpful if you or your kahuna are going to use Medicare to cover the costs of home health services.
So our caregiver resources presentation today introduced you to the basics of home health care and provided several resources and helpful tools. We will now be opening the floor to anyone who has any questions for us. We're happy to answer any of them now. Thank you so much.